Economic stimulus package beneficial for all Malaysians. Agriculture Ministry to propose reopening of farmers' market and morning markets. Good afternoon, thanks for joining us. And you're watching Updates at Noon. I'm Jessica Lee. The Health Ministry confirms that 44 positive COVID-19 cases were discharged, bringing the total cumulative of patients recovered from the outbreak to 259. Health Director General Datuk Dr. Nur Hisham Abdullah in his daily briefing yesterday, however, also noted that the total COVID-19 death toll has risen to 26, with most of the patients who died were elderly and had a history of chronic illness.
Sehingga kini terdapat pertambahan 3 kes kematian baru berkaitan dengan COVID-19 yang telah dilaporkan ke CPRC Kebangsaan. Ini termasuk 1 kes pelaporan yang disiarkan di laman Facebook Ketua Pengarah Kesihatan pagi tadi. Justru jumlah kumulatif kes kematian COVID-19 di Malaysia adalah sebanyak 26 kes, iaitu dengan kadar kematian 1.1%.
As at 5 p.m. yesterday, Datuk Dr. Nur Hisham also said a total of 130 new COVID-19 cases have been recorded, bringing the total to 2,161. Presently, 54 COVID-19 patients in the country are admitted into the intensive care unit or ICU, with 34 cases requiring respiratory aid. The bulk of the patients continue to be from the Sri Petaling public cluster. Meanwhile, in the latest update in Serdang Hospital, a patient under investigation or PUI for COVID-19 was found dead in the toilet of the hospital ward yesterday. Sepang District Police Chief ACP Wan Kamarul Azran Wan Yusof said the body of the 62-year-old male patient was found at 7:40 p.m. by a nurse. Previously, he was admitted into the hospital on Thursday. ACP Wan Kamarul said the case is still being investigated. The Health Ministry will set up a special committee to conduct audit on the death cases of COVID-19 patients in the hospitals. Health Director General Datuk Dr. Nur Hisham Abdullah said the National COVID-19 Mortality Review Committee will be chaired by infectious disease consultant specialist, who was also the former Deputy Health Director General of Research and Technical Support, Datuk Dr. Christopher Lee. Datuk Dr. Nur Hisham said that the decision to set up the committee was made during the National Crisis Preparedness and Response Centre meeting yesterday. Datuk Dr. Christopher Lee will be assisted by experts from various fields, as the Medical Care Quality Branch of the Medical Development Division will act as the technical secretariat for this special committee. Every detail on management and treatment given to every COVID-19 related death cases will be reviewed by the committee. The results found by this committee are expected to be used in improving the management of COVID-19 cases. Prime Minister Tan Sri Muhyiddin Yassin has announced the 250 billion ringgit people-centric economic stimulus package, or Prihatin, to overcome the impact of COVID-19 pandemic. The amount is about 10 times larger than the first economic stimulus package announced on the 27th of February. In this package, 128 billion ringgit was allocated for the benefit of the rakyat, 100 billion ringgit to support small and medium enterprises (SMEs), and another 2 billion ringgit to enhance the country's economy.
Pakej Prihatin ini akan menyediakan bantuan segera untuk meringankan beban yang ditanggung oleh anda semua. Sama ada anda seorang nelayan di Kukup, Johor, ataupun pekebun kecil di Jeli, Kelantan, anda pengusaha chalet di Cerating ataupun penarik beca di Melaka, niaga pasar malam di Kuala Lumpur ataupun pasar tamu di Kundasang, anda semua akan menikmati faedah ataupun manfaat daripada pakej rancangan ekonomi yang peduli rakyat ini. Seperti yang saya sebutkan, tiada golongan yang akan tercicir. No one will be left behind.
Now, the Premier also announced an additional allocation of 1 billion ringgit to the Health Ministry for them to procure the devices and services needed to combat COVID-19 infection.
Saya sedar dalam situasi getir pada waktu ini, kaki tangan kesihatan kita sedang bekerja bertungkus lumus dalam keletihan dan keadaan yang agak tertekan. Namun mereka terus cekal berjuang untuk mengharungi cabaran yang hebat ini. Sebagai menghargai pengorbanan mereka, kerajaan akan meningkatkan allowance khas yang diterima daripada RM400 kepada RM600 sebulan mulai 1 April 2020 sehingga wabak ini berakhir.
The Premier also said the insurance and takaful industry will create a special fund of 8 million ringgit to cover the COVID-19 screening tests that is worth up to 300 ringgit. Meanwhile, Health Director General Dr. Nur Hisham Abdullah welcomes the special allowance announced by Tan Sri Muhyiddin for the frontliners in the health sectors. He regards the allowance as an appreciation to their sacrifice in the battle against COVID-19.
I think that's very welcome because, in fact, our nurses, our staff has been working around the clock for the last 4 months. It's not 1 month, but 4 months because we started early. And I think it's a form of appreciation over the months or weeks. You know, they have actually contributed, sacrificed their families and time to make sure that we perform.
The frontliners, doctors, nurses and other healthcare workers had their 400 ringgit monthly special allowance raised to 600 ringgit from 1st of April until the end of the pandemic. Now, the Bantuan Prihatin Nasional has also allocated 10 billion ringgit to reduce the people's financial burden. Now, this will include a one-off cash payment for the M40 group and below.
Jumlah bayaran yang akan dibuat ialah pertama RM1,600 kepada hampir 4 juta isi rumah yang berpendapatan bulanan RM4,000 dan ke bawah. Bayaran RM1,000 akan dibayar pada bulan April 2020 dan RM600 pada bulan Mei 2020. Kedua, RM1,000 kepada hampir 1.1 juta isi rumah yang berpendapatan lebih RM4,000 sehingga RM8,000. Ia akan dibayar pada bulan April 2020 sebanyak RM500 dan baki RM500 pada bulan Mei.
Meanwhile, single individuals aged 21 and above with monthly income below 2,000 ringgit will receive 800 ringgit, and those with income between 2,000 and 4,000 ringgit will receive 500 ringgit. Tan Sri Muhyiddin also said that the remainder of Bantuan Sara Hidup or BSH that will be paid in July involved an allocation of 3.2 billion ringgit. Now, the Premier has also directed all the ministries to review their respective budgets to look for savings so that they can be used to meet the medium-term measures to deal with the outbreak of the virus. Now, he also directed the Ministry of Finance through the Unit for the Implementation and Coordination of National Agencies on the Economic Stimulus Package, or Laksana, to ensure that the 250 billion ringgit Prihatin package is accessible to all.
Saya tahu saudara-saudari yang berada di rumah-rumah panjang di Sarawak, di Sabah, penempatan orang asal, di kawasan-kawasan yang jauh di pedalaman di segenap curug rantau negara ini mungkin bimbang bantuan yang disediakan oleh kerajaan lambat sampai. Dan untuk itu Kerajaan Persekutuan akan bekerjasama dengan kerajaan negeri, khususnya di Sabah dan Sarawak, untuk pastikan semua bantuan yang disediakan oleh kerajaan sampai dengan cepat.
Meanwhile, Tan Sri Muhyiddin also said an 8 million ringgit special fund will be set up by insurance and takaful players to bear the costs of COVID-19 screening tests worth up to 300 ringgit per policy. Prudential Life Insurance Agency Association Malaysia, or Prulia President Mani Raja Chandran, hopes that the insurance policy holders will make use of this initiative to undertake the tests at a private hospital or lab.
Dan pada masa ini, hospital dan kaki tangan kerajaan memang bekerja bertungkus lumus. Seperuntukan RM300 setiap seorang yang disediakan oleh syarikat insurans dan takaful akan dapat mengurangkan beban hospital kerajaan at least dari segi saringan.
This initiative is expected to reduce the workload and costs borne by the healthcare facilities, which will usually be crowded by other patients. He also added that policyholders whose source of income have been affected by this pandemic also are eligible to enjoy this flexibility in payment of premiums. This includes deferment of 3 months insurance premiums or family takaful contribution. Now, to overcome the surplus in agricultural production, the Agriculture and Food Industry Ministry plans to propose that the morning markets and the farmers' markets be allowed to operate. And now its Minister, Datuk Sri Dr. Ronald Kiendi, said, however, it should follow the stipulated conditions set under the Movement Control Order, or MCO.
Jadi supermarket kenapa dibenarkan kerana adanya health screening yang dibuat. Jadi lambakan kerana semuanya tertumpu kepada hypermarket dan kedai-kedai penjualan yang tertentu. So definitely ada pengeluaran yang berhadapan dengan masalah sedemikian.
He said agricultural distributors, especially fish and vegetables, are now facing a glut of their products since only supermarkets are allowed to open during MCO. He said this after a dialogue with representatives of the food industry at his ministry. Datuk Sri Dr. Kiendi added that the proposal would be raised at a special ministerial meeting on MCO. Enforcement of MCO nationwide has been extended until 14th of April. Now, people-centric economic stimulus package, or Prihatin, that was announced by the Prime Minister yesterday has been described as inclusive. Perak Menteri Besar said that such initiative has also been implemented by the Perak state government.
Pun dimulakan oleh pihak kerajaan negeri Perak daripada awal lagi, begitu juga dengan pihak badan-badan berkanun di negeri Perak dan syarikat-syarikat berkaitan kerajaan di negeri Perak, kita mengambil langkah yang sama.
In other development, Datuk Sri Ahmad Faizal also said that the state government has been making preparations for any possibilities that might happen during the movement control order. He also called on every quarter to cooperate in order to break the chain of COVID-19 infection. And that's it from us this afternoon. In our top story, economic stimulus package beneficial for all Malaysians. Now, don't forget to wash your hands regularly, sanitize, practice social distancing, and most of all, let's adhere to the movement control order and just stay at home. And News on 2 comes on again at 7 this evening. I'm Jessica Lee. Thank you for watching. Stay safe.